أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Today we are going to discuss a little bit about glanders or Farcy, disease of horses. So one of the oldest known diseases of the horses, still present in many parts of the world. The etiological agent of this contagious disease is Pseudomonas meliae. The disease is far more common as latent glanders than the overt infection, which is characterized by nodules or ulcers on the respiratory tract and skin, usually following ingestion but also possible through wounds. So disease is far more common as latent glanders than the overt infection. And note that this disease is characterized by nodules or ulcers on respiratory tract and skin, usually following ingestion but also possible through wounds. Clinical signs, so far as the clinical signs of Glanders or Farcy is concerned, there are three forms of the disease. Number one, acute respiratory form. Number two, cutaneous form of the disease. And number three is chronic respiratory form. First, we will discuss acute respiratory form, then chronic respiratory form, and finally we will discuss inshallah cutaneous form of the disease. In acute respiratory form, mainly this form is seen in asses and mules, less commonly seen in horses. In this form, there is high fever, cough, and nasal discharge is also present with ulcers on nasal mucosa. So in this case, main clinical sign is cough and nasal discharge with ulcers on nasal mucosa. Fulminating bronchopneumonia is also present, and nodules on lower limbs or abdomen, they may also be seen in acute respiratory form. And in chronic respiratory form, this form is mainly seen in horses and commonly occurs with cutaneous form. Chronic respiratory form mainly seen in horses, and this form does not occur alone, it occurs with cutaneous form. And insidious onset, ulcers on lower turbinates and cartilaginous septum with purulent nasal discharge. So in this case, ulcers are seen on lower turbinates and cartilaginous septum with purulent nasal discharge. Chronic pneumonia is also seen in this case. Miliary lung abscesses are found in this chronic respiratory form of the disease in horses. Next is the cutaneous form of glanders or Farcy. Predilection site is medial hock but can occur on any part of the body. This cutaneous form of the disease may occur at any part of the body, but predilection site is medial hock. Swellings which ulcerate, producing dark honey-colored pus. Lymphatics may become involved with enlargement of regional lymph nodes. This is cutaneous form. Enlargement of regional lymph nodes may also be seen in this case. Diagnosis. Now is the diagnosis. Diagnosis is very difficult from clinical signs in all but very advanced cases of respiratory form may also be diagnosed by the clinical signs, and there should always be laboratory confirmation as well. Diagnostic aids. So far as the diagnostic aids are concerned, impression smear of the pus from fresh lesions can demonstrate the gram-positive double-walled spores of this Pseudomonas mallei. Pseudomonas mallei is actually gram-positive doubled wall spores. Maline test may also be performed in this case. Maline is injected 0.1 ml intradermally into the lower eyelid. Note it please that this maline is injected 0.1 ml intradermally into the lower eyelid. The test read at 48 hours with a positive reaction comprising marked edema of the lid with blepharospasm and a severe purulent conjunctivitis. So if test is positive, this test is read after 48 hours, and if test is positive, then there would be marked edema of the eyelid with blepharospasm and a severe purulent conjunctivitis. And next, diagnostic aid may be taken through complement fixation test. Complement fixation test is very effective to diagnose Pseudomonas mallei, which is causative agent of Farcy or Glanders. Differential diagnosis. So far as this differential diagnosis is concerned, episodic lymphangitis may be differentiated from this disease. No pulmonary involvement in this case or systematic involvement in episodic lymphangitis. So in this disease must be differentiated from episodic lymphangitis in which there is no pulmonary involvement or systematic involvement. Next, ulcerative lymphangitis should also be differentiated from this disease. In ulcerative lymphangitis, no lymph nodes or systemic involvement occurs. No lymph node or systemic involvement occurs. Other pneumonias or severe strangles may also be differentiated from this glandular disease. Infected tooth, guttural pouch infection, or sinusitis may have unilateral nasal discharge but do not show ulceration. So these diseases should also be differentiated from glanders. Next is the treatment. Sulfonamides have been shown to be very effective in men and experimental glanders in hamsters. So sulfonamides, they are very effective in this case, and disease may be treated for 21 days. Treatment, sulfonamides are very effective as I have told earlier. Next is the prognosis. Acute respiratory form. In acute respiratory form, death in few days occurs, so prognosis is very poor. in acute respiratory form. And in chronic respiratory form and cutaneous form of disease, illness occurs for months, frequently showing an improvement before they make an apparent recovery to persist as occult carriers, make a full recovery, or they may die. So prognosis is 50-50% in these two forms of disease, cutaneous form and chronic form. Control. For control, quarantine infected premises is very necessary. Next is destroy clinically affected cases of the horses, mules, asses, etc. And next is that all imports should be subjected to the Maline test or complement fixation test. And note please that zoonosis generally may occur. This is a zoonotic disease, so a zoonosis generally fatal for man. Thank you very much. This was little bit about Farcy or Glanders, mainly disease of horses and oldest disease of the horses. Jazakallahu khaira. Allahumma salli ala Muhammad wa ali Muhammad wa ajil farajahum.